Hi, this is Dr. Bernie, once again, coming to you on behalf of homeopathic medicine. And today we are going to talk just briefly about a syndrome called Ehlers Danlos syndrome. Let me spell that for you. It's EHLERS-DANLOS syndrome. Now, this may be foreign to you, but it's out there, and it affects many people, mostly children. It's kind of a syndrome type of disease that affects every part of the body. And specifically, to give you some background on what the body goes through, you're in pain. Your skin is almost like rubber. It stretches very far. Your joints are very limber, and it's almost as though you have joints that will bend further than any other person's normal joint and tendon. So it's kind of like you're super double jointed. You can bend your fingers back, all kind of things like that. You think it sounds like fun, but it's not. It's very crippling. The older you get, the more you experience in the way of debilitating as a disease or syndrome. I like to call it a disease. The classical it's Ehlers, not Ehlers, Ehlers Danlos syndrome is a genetic connective tissue disorder. So it's genetic, and it's a tissue disorder caused by defects in a protein. Now listen to this. Caused by defects in a protein called collagen. Common symptoms will include skin hyperextensibility. Remember I said bending the fingers back. Abnormal wound healing and joint hypermobility. Now, this is a genetic which encodes type V collagen. V as in Victor. In more rare cases, mutations in the gene encoding type 1 collagen may be found. The condition is inherited, and it's dominant in manner. The treatment and management from your Western medicine doctor will be focused on preventing serious complications and relieving associated symptoms. So they cannot cure this, but homeopathy does. Now that's a tough one to say. And I'm sure if the FDA caught wind of this one, they would lynch me. Because, that's the way it goes in the United States. We hide behind the FHA, and nobody makes an outward mistake or says the wrong thing. And, if you do, you're put on the backside of everything. And they cease and desist you. So I'm going to tell you right now, I have treated Ehlers Danlos syndrome successfully in the past and cured many people of this disease. And I do it with medicines that are all homeopathic. Now, this is all natural. So if you're not familiar with homeopathy, you need to listen to my other broadcasts. I'm a homeopath. I studied in London in 1994. I've been in business ever since. So I'm doing something right, correct? Okay, here's the deal. The real deal is I get all of my medicines from London. I never get anything from the United States because they don't cure anything out here. The FDA, once again, steps in and says, if we can keep you sick, we can make more money. So why would you want to cure things like cancer, which there is a cure for out there? Why would you want to cure even pneumonia or the common cold or herpes or any STD? Why would you want to cure these debilitating diseases when, gosh, we can make so much money on you? Well, that's the FDA's point of view. That's your Western medicine doctor who has to succumb to the FDA requirements. As homeopaths using natural substances, we are not required to work under the FDA because they do not approve us. So what's the big deal about that? Okay, so some people will say, well, if the FDA doesn't approve your type of healing, then it must not work. You know what? If the FDA did approve our method of healing, they would call it a drug. Back on the same road, on the same street. Call it a drug. Everything is a drug. Everything that isn't a drug, obviously, then to them does not work. Well, that's a bunch of baloney, because homeopathy works better than any drug I've seen. I don't know. I can get cures with homeopathy that Western medicine will never procure. Never cure. They don't know how. Okay, here we go, FDA. I'm sure if the medical doctor wasn't so brainwashed into Western medicine, he would realize there's nothing better than natural medicine. And natural medicine, and I know I'm getting off the track here of Ehlers Danlos, but we'll get back on track in a second. Natural medicine is not a spoof. It's made from real things. It's made from homeopathy, made from the earth. Didn't God put us on earth and say, you can get any kind of healing you want right here on your earth? It holds every secret to every healing. What do you think the Native Indians did? What do you think the African tribes do? They survived because they use all natural means for healing. I should have called this a segment on natural healing. Homeopathy is made from animal, vegetable, mineral. The rocks, the dirt, the plants, animal organs, human organs, things like that. I mean, we make real stuff that really works. Difference is we take all the poisons out of it. So you're not getting any poison that a drug per se would give you. So like say you take something for your liver and it kills your other organs. That's just the way it goes. Do you ever see a commercial on TV? Try this medicine, da-da-da-da-da, good for da-da-da-da-da, but will cause strokes, heart attacks, this, that, you'll die, you'll seize, Okay, that's where that's coming from. What do we say in homeopathy? We say, take this medicine, let's cure you in the quickest way possible. That's it. That's the whole thing right there. Back to Ehlers Danlos. What do I use to help cure? Among many medicines, and among all the medicines that I get from London, because they make everything that the United States will never acknowledge, I use collagen, because the protein from collagen is what you lack with Ehlers Danlos. Now, you may not even know you have Ehlers Danlos. You'll go all your life being hypersensitive and hyper this and hyper that, and how come my skin stretches, and how come I can roll my earlobe down into a roll and nobody else can. Oh, gee, I must be special. I must be extra special that I could do this, so maybe I'm just double jointed. It has nothing to do with that. Now, there are people out there that are, double jointed, but it's nothing like this syndrome. This syndrome goes way beyond. The signs and the symptoms of classical EDS, which is short for Ehlers Danlos syndrome, may include smooth, velvety skin that's highly elastic, stretches, but bruises very easily. A 9-year-old kid cannot go through this, and there are plenty of them out there. Trust me, I know, I cure them. Abnormal wound healing that may result in wide scarring, flat or depressed scars. That's not good. Joint hypermobility that leads to frequent dislocations and subluxations. Now, let me explain. Your ankles will turn in when you're walking. Your knees might go in and out of place. Your hips could go in and out of joint place. The elbows and the shoulders especially can go out, and your fingers. So if you're walking down the street and you have Ehlers Danlos, suddenly your ankles turn inward and you're not walking straight. Has nothing to do with flexibility because you're double jointed. It's a disease. You can also have calcified hematomas over your pressure points, such as, let me turn the page, subcutaneous spheroids. Ah, gosh. Your forearms, your shins, everything is affected. Tissue fragility that could lead to hernias. So there are a lot of Ehlers Danlos children that go in for hernia repair. And nobody knows why the hernia existed. Well, this is one reason, but I'm going to tell you this. Listen carefully. A Western medicine doctor knows very, very little about Ehlers Danlos. That's why they can't cure it. They don't know enough about it to even discuss it. So what do? They treat the symptoms instead of the root cause. They say, well, if it's inherited and it's genetic, there's nothing we could do to change these genetics. I'm not saying change the genetics. I'm saying find some way to help these people get well. Collagen is one answer because of the protein in it. And I get fresh collagen from London all the time. Other complications, rectal prolapse. That's not fun either. When you have rectal prolapse, you need surgery because your rectum is falling out. How many of you ladies have experienced that? A rectal prolapse. That happens all the time. Your rectum actually descends and kind of falls out of the body. So you need, most doctors will use mesh to hold it up and reattach it. Sometimes, and let's go a step further, with a rectal prolapse, if you're real unlucky, that rectum is going to feed right into the vagina. And now you've got to have vaginal repair and rectal repair. So this is not a joke. These are things you don't know. Who tells you? The doctor's not going to tell you this. You're lucky if you get 15 minutes with your doctor after waiting an hour for him to walk into the room. Cardiovascular abnormalities such as mitral valve prolapse. How many of you people have heard of or have mitral valve prolapse? That's pretty darn common. It's pretty common in the United States in our time. Would they associate mitral valve prolapse with Ehlers Danlos? I don't think so. They're going to put you into surgery. They're going to fix that valve. It's going to happen again. Or, how about this? Aortic root dilation. Gee, how fun must that be? That's the enlargement of blood vessels that distributes blood from the heart to the rest of the body. So, if you're not getting the proper amount of blood flow to your body, what happens? You lose oxygen. Now you can't breathe right. You get tired. You can't stand. You can't do things that a normal person would do that, doesn't get tired and everything because you've got some heart problems going on. So when you go to your cardiologist and they say, oh, you have mitral valve prolapse, that's all they're looking at. They're not going to say, gee, why did this happen? If they find the predisposition to mitral valve prolapse, they might find Ehlers Danlos. What I'm telling you is they don't go deep enough. They can't find these things. That's why they can't treat them. So, a person that has Ehlers Danlos syndrome may not have all the symptoms that somebody else has. They might have some. That's why it's so hard to detect. So, you're going to have very fragile skin. You're going to have paper-thin skin causing scarring. Let's turn the page again. So much information on the internet about this. You're going to have generalized joint laxity. That's hypermobility of all your joints. You're going to have hyperelastic skin. You'll be able to take your cheeks and pull them way out. Soft dough type of texture skin. Stretch marks, unusual stretch marks. Infrequent bowel movements. Now, means chronic constipation, you guys. And some people don't go to the bathroom for 3 and 4 days, and that's been all your life, and you wonder why. And so you take all kind of medication to help you go to the bathroom. Well, 30% to 79% of people have the symptoms of infrequent bowel movements. You're tired, you're fatigued. You have acid reflux, which is called gastroesophageal reflux, GERD. Most of you guys do have GERD because the way you eat. Muscle spasms, muscular weakness, loss of or weak muscle tone. Hey, how many of you have that? Osteopenia, very common. Bone disease, nausea, poor wound healing, vomiting. Oh my gosh. You want to live with Ehlers Danlos, or do you want to call me? And let's put an end to all of this stuff. There's so many more things here. A bulge in the wall of the root of the large artery that carries the blood away from the heart. There's abnormality of the jaw joint. So when some of you eat, your jaw hyperextends and it clicks, and you go to the dentist, they say, oh, you got TMJ. You don't have TMJ. You may have Ehlers Danlos. Are they ever going to find it? No, I don't think so. So you need to call me if you have any idea that this might be going on with your body, and I've given you enough symptoms to check, because no doctor will. They don't know what they're doing. Not when it comes to this. You know, thank God for the surgeons, thank God for your doctors and stuff like that, but, you know, nobody knows everything. Like, I don't know Western medicine. They don't know homeopathy. That's the way it goes. That's our country. That's why I get my medicines from London, guys, because I can get anything I need to help you. Collagen, among many other medicines, are used to treat Ehlers Danlos. And I have children that I send the medicine, and the mothers give them the medicine, and in one day they're feeling better. And that's how it works. This is Dr. Bernie. I'm a homeopath. I'm in the Mesa, Arizona area. I treat everyone online. Everything is face-to-face online now, which is, it's what a lot of doctors are doing now. Because of COVID, we closed our offices and things like that, but we're doing the same good work if we can see our people online. That's important. You can reach me by calling 480-703-0151. You can go to gilbertnaturalmedicine.com and read all about me and what we do at Gilbert Natural Medicine. You can see our handmade natural products that we make for you, which are just out of sight. They're the bomb. They're wonderful. Everything we do is so much fun and so good and so rewarding. Please visit us, 480-703-0151. And school's out.